Hello, everyone, and welcome to today's episode of the Power Up Nursing Podcast. I'm Dr. Kimberly Delbo, and I'm thrilled to have you join us for another inspiring conversation about the future of healthcare, technology, and innovation. Today, we're diving into a topic that's shaping not only how we care for patients, but also how we teach, learn, and lead. And that's artificial intelligence. And who better to explore this topic with than our friends at Skyscape, a company that's been empowering healthcare professionals for decades through evidence based tools and digital innovation. Joining me today are Kartik Shah, who's the co founder and COO of Skyscape, and his team member, Kristen Snoder Smith. Welcome, Kartik and Kristen. We're so grateful that you could join us today.
Thank you for having us.
Thank you for having us.
Oh, yeah, we're thrilled. Thank you for being here. Kartik, let's just start with you. Let's just jump right in. For listeners who might not be familiar, could you share a little bit about Skyscape's story and how it's evolved over time from one of the most first mobile medical reference platforms into a leader in AI-driven healthcare solutions?
Sure. Firstly, thank you, Dr. Delbo. It's a pleasure to be here and talk about the topic which is dear and near to our hearts, technology, and now transcending into AI. So, Skyscape has been a pioneer in mobile healthcare, going back to year 2000, which is
Mhm.
almost 25 years ago, when we launched trusted mobile medical references on Palm Pilots. These were little devices, and we always believed the mobile will be, very useful for healthcare. And since then, of course, technology has come a long way with now more powerful devices such as iPhone and Android, and this has become pretty much ubiquitous now. And this
Mhm.
is a full library of trusted knowledge in your pocket, used in medical and nursing education and healthcare practices daily. And
Mhm.
Skyscape always had this goal of making these tools easily available for healthcare professionals so
Mhm.
that they could be more efficient in their daily work. They already have so much to do caring for patients, and the last thing they want to do is deal
Yes.
with technology that is not usable or not friendly, or having to reference or carry heavy books. So we always focused on that. And now moving into the this year and the past year with the AI integration, which has come a long way,
Mhm.
Skyscape makes this information available in a conversational paradigm with trusted medical knowledge. And the key thing is it's zero hallucination because it all comes from trusted content. And
Yes.
further, the AI integration also into real-time communication and collaboration through
Mhm.
Skyscape's Buzz application
Ah.
improves the efficiency, increases, the HCAP scores for different enterprises, reduces rehospitalization, and we have proven metrics for that. And it's a big benefit to healthcare enterprises, especially in the home health and hospitals. So,
Wow, that's fascinating, Kartik. I mean, to see where it's been, but now where it's coming, and your vision for the future is amazing. And I can't help but to think, having seen the demo and been in these conversations, to see the value in what you have to offer. So thank you for your leadership. And Kristen, I want to shift to you and just kind of get your perspective here around Skyscape and what inspired this next chapter of integrating AI into your tools, and how have healthcare professionals or nurse educators or educators in healthcare responded so far? I'm not hearing you. You're muted there, dear.
Oh, there we go.
Hi. Yes.
Sorry about that.
Okay.
Thank you. Well, as a marketing content manager at Skyscape, our inspiration comes from having trusted, clear, and accessible information that can change outcomes. We believe that naturally, the next evolution was integrating AI with Skyscape's vast library of medical and nursing resources. So
Mm.
we have Queries AI, which takes decades of expert authored and evidence-based content and makes it instantly searchable and conversational in a clinical context.
Mm.
Clinicians and educators can ask complex, nuanced questions and receive precise, reliable answers that they can trust. It's not Dr. Google or Dr. ChatGPT results, but content grounded in a medical authority.
Ah, it really is transforming how, healthcare is going to be performed. And as we look at the power and the potential for AI, I just want to ask, from a data analysis perspective, Kartik, AI can be very helpful, right, in helping us get the resources that we need, like you said, on your, at your fingertips and in your pocket, really, right where they're at the bedside to help them make the decisions that they need to make. But how do you see AI specifically enhancing clinical efficiency and supporting real-time decision making?
Yeah, that's a great question, Dr. Dalbo. One of the things with AI also comes, the power of it and how people use it.
Hmm.
And of course, with AI, there are instant answers available, like everybody has used ChatGPT. Uh, but there also comes a word of caution, especially in the healthcare and medical field, in the clinical world, because at some point you cannot trust ChatGPT or other LLMs when you're not sure of the source of the answer, right? So yeah, you can ask for ChatGPT, for example, to lay out your trip for you. But if you want to ask ChatGPT saying, should I be prescribing 2 milligrams or 2.5 milligrams of
Yes.
this drug, it's a little scary, right? So what we see AI definitely helping in decision making and clinical efficiency when you surround it with the right tools and technology behind it. So, for
Yes.
example, Skyscape, only provides AI interfaces for
Mhm.
such questions with trusted content and with a conversational paradigm. So, beyond looking at references from index and table of contents, now you can interact like a ChatGPT like interface, but you at least know that the answers are coming from trusted content from editorial medical published content or through KOLs and well-known authors. Further routine tasks, you can apply AI through the ambient listening and note summary, which can improve clinical efficiency a lot. As you know, documentation is a big problem. A lot of healthcare providers are spending a lot of time, and
Yeah.
their AI, the models are getting better and better, and they can
Mhm.
summarize notes, which ultimately, of course, the provider needs to make sure that they validate, but it gives them a great starting point.
Sure. Wow. There's so much that we could do with that. Really, it truly is powerful, right? More powerful than I think we even imagine, and trying to change our workflow and promote efficiency. But, using it in a wise manner, an ethical manner is really key. And I love that it pulls from reliable sources, that it's already vetted that on the back end. So thank you for sharing, Kartik. This next question is for Kristen. Kristen, can you share a real world example or maybe a success story of where Skyscape and its AI tools have had a difference or made a difference for a nursing student or an educator or maybe a clinician or one of
Sure.
your clients?
Sure. I'd love to share a
Yes.
real impact story of how our Aquarius AI has transformed teaching and learning and care planning. So, a professor began teaching advanced med surg at a nursing program. She found herself spending hours creating lesson plans, updating care scenarios, and writing study guides for her students. Her challenge was simple: there's too much to teach, not enough time to create engaging content. And that changed when her program adopted Skyscape's nursing solutions with Aquarius AI. As an educator using the Aquarius
All
AI
right.
assistant, did you have a question?
No, I was just saying it's so hard on some instructors, right? They're having so much they have to fit in to a certain, to a certain time period. It can be quite overwhelming for them. So leveraging this, it seems like a logical resource for them, right?
Definitely. Using the integrated Aquarius AI assistant, they can instantly generate lesson outlines aligned with their course objectives, create custom NCLEX style quiz questions, pull from the trusting nursing references like a Davis Drug Guide or Bruner and Sudas or Tabers, all within our platform. It's like having a co-instructor who never sleeps. You can spend
Yeah.
more time mentoring students instead of formatting slides.
Yes.
For the students, it really helps build personalized study notes and question sets. If they were preparing a cardiac care plan, they could ask AI to identify related conditions and drug interactions. It can
Yeah.
generate concise evidence-based connections drawn from these trusted clinical resources. One student quotes, "It helped me understand why a treatment works, not just what it does." And
Oh,
this results in, increased test scores,
sure.
reduced anxiety about complex care
Wow.
planning,
So important.
and it really saves time on administrative research and tasks. And, you
Mhm.
can spend more time hands-on learning and critical thinking.
Oh, I love that. I love that. The fact that you said it can reduce their anxiety is huge. I mean, right now, nursing undergraduate students are more likely to be depressed or anxious than any other undergraduate major, shows the data. I think the figure I last saw was like around 56% of nursing undergraduate students are suffering of mental health conditions.
It's a
So,
tough
like,
program, so I can totally understand that.
it's very high vigor, right? We know it's very rigorous, but anything we can do to kind of help alleviate unnecessary anxiety, I think makes logical sense, especially in this VUCA world that we live in that's constantly changing and can be very stressful for so many people. So thank you for sharing. And of course, everything that we do at Power Up Nursing is really involved with promoting the well-being of nurses and innovative care models to really promote the quintuple aim. And one of those aims is to restore joy to practice, right? Uh,
Hmm.
I often talk about the importance of balancing technology and that human connection. So I love the fact that you mentioned that it allows the educator more time to spend with the student, interacting with them and supporting them and encouraging them, right?
Hmm.
Because sometimes we're so busy with all the other stuff we have to do. It can be very challenging. Haven't been a professor for for a number of years, but so thank you. So kind of along the next question, and I'll let you decide who you want to answer it, but how can AI be used to help clinicians or nurses or other healthcare professionals spend more time on that human side care delivery rather than less? Because that's a really big component as we roll out AI, is not to lose sight of that human, right? That person-centered care that we deliver.
Yeah, I can answer that a bit. You know, that is a very very important thing that AI, one thing it cannot do is replace human emotions, right? When you are, it can help, in your daily workflow, increase efficiency, but it
Mhm.
cannot, help in touching and feeling the patient, seeing them firsthand, seeing what they are going through, seeing, so and that emotions that come, talking to, for example, a family member, right? AI cannot just replace that. I mean, you can, yeah, put in ChatGPT what I should talk to the family, but there is care, there is, feelings behind that, and that is something which, will continue with the healthcare practitioners, which is, of course,
Oh, sure.
a great, thing that they do in providing care.
Yeah.
So we feel that will continue.
Mhm.
Without the AI component in it.
Yes, thank you, Kartik, for sharing that. And I think of that as, and I just spoke with some nurses at the North Dakota Nurses Association not too long ago, and we talked about how when we're leading the next generation of nurse leaders in an AI-driven world, really AI is here to augment, right, and to amplify the role of a nurse. I think, if anything, that heart-centered connection that we empathetic connection that we have, that compassion that we have in that sacred space as the environment for the patient is only going to become more valuable with AI, not less. So I appreciate you sharing that and recognizing that too. Thank you. So I want to shift gears and talk a little bit about empowerment and workforce and education. So, obviously, education is really one of my favorite topics to talk about, and empowerment. But how can AI help to bridge the gap between classroom learning and clinical practice in this VUCA world that we're living in? It's volatile, it's uncertain, it's changing, it's ambiguous. Um, you know, here knowledge is doubling every 12 to 18 months, in some cases 12 to 18 minutes depending on the industry. So what are you doing at Skyscape to ensure that nurses and healthcare professionals have instant access to that latest evidence-based knowledge?
Yeah, Kristen, you want to take that and talk about maybe Skills Hub and EBMG and evidence base and the most current information?
Yeah, so we have a few titles. We have one, our Skills Hub title, which is about 128 skills, which allows a student and an educator. An educator can opt to release only a portion of those skills as they're teaching them, so they're not overwhelmed. The students aren't overwhelmed with 128 skills, so they can introduce an assessment section or a fundamental section or intravenous section or something like that as they're learning it. What's nice about this the Skills Hub tool is it allows the student to practice, and then they can watch a video so they can see, how they should be doing it. Then they can also record themselves in the sim lab and share it with a peer or their faculty for real-time feedback. So they can see what, oh, you forgot to do this step, or you greeted the patient wrong, or you forgot to check who they are, or, you could use a different tone with this person, especially if the English is a second language. Different nuances mean different things, whether you're the patient or the student. So Skills Hub has a lot of functionality. It also gives confidence because you have that detailed step-by-step instruction of the skill in your hand. You're like, oh I haven't done a Foley catheter in 2 months. So how do I do that? Quick, read up on it, watch the video. Then you can go in with some confidence at the patient bedside to go in and perform that.
I love that. Wow. And as we're shifting to this competency-based, model in education and nursing education, and truly creating the leaders that our healthcare system needs, I can't help but to think how this Skills Hub that you're describing could be so helpful for educators and for students in real time, really connecting that learning with real world application. And that's so important. So Kartik, thank you, Kristen. That was really helped me understand the Skills Hub a little bit more clearly. Kartik, what role do you see like organizations like Power Up Nursing and Skyscape partnering to strengthen that healthcare workforce through innovation and AI-driven learning?
Yeah, partnerships are always great because when you partner, 1+1 becomes, much greater than 2, right?
Yes.
And Power Up Nursing and Skyscape, they are kind of a perfect hand and glove fit. And Power Up Nursing is powered by nurses, no pun intended. And you're a big part of that, Dr. Kim. You've lived that nursing journey. You know exactly the challenges faced in the real world by practitioners. On the other hand, Skyscape is an innovative technology company with years of experience. We are serving the needs of healthcare practitioners. So to have somebody like a Power Up Nursing understanding what is happening out in the field, and then Skyscape who has so much experience serving the needs of healthcare practitioners, definitely makes this great benefit ultimately for the end users, right? And the end users here are the healthcare providers, and we can develop the appropriate solution. And now using AI, we can come up with, okay, what are the next things that we can alleviate the stress on these healthcare provider and the nurses daily, and bring them the right tools and technology, and also make sure they're practicing in a secure manner. For example, you don't want to use SMS when you're exchanging PHI, so that kind of feedback from the field, and then us giving them the right tools like Skyscape's Buzz, which is a fully HIPAA compliant platform to exchange messages, definitely helps.
Oh, wow. So wait, I just want to back up a minute. I mean, I just love that you have shared the value and the power that's in partnership and innovation, Kartik, and you shared it so eloquently. With healthcare shifting to a whole new model where health is going to be more delivered out into the community, we're going to be seeking to break down silos between practice and education more and more, and leveraging a tool like buzz to make that happen, so that, like, say, nursing students can go out into the community, maybe their senior year of nursing school, and work alongside patients right there in the community where they live, learn, work, play, and pray. Truly shaping healthcare beyond the walls, which we know has shown that that's where health is defined, right? So I just appreciate you sharing that and that value that's in partnership, and we're honored to partner with you, and so grateful. I've learned so much from you, and I want to thank you. um, but Kristen, this next one's for you. You interact closely with users, so what are some of the most common misconceptions that some people have about AI in healthcare, and how do you help them see that real value?
Well, honestly, I think everyone, whether you're in healthcare or what you're doing, I have a son who's the senior in high school, and it's like, what do you think about what job can I do that AI won't replace, right?
Yeah.
So in general, people think, oh, AI will replace clinicians, and no, I mean, AI is designed to assist them, not replace them. It automates the day-to-day tasks. It does the data heavy tasks so they can focus on the complex decision making and patient care. It's a collaboration. It's not a competition. AI exists in a clinical capacity. It doesn't erase it.
Yeah.
Other things people say is AI can make decisions we can't explain. Well, modern healthcare AI emphasizes the explainability, if that's even a word, showing how it reached, the recommendation based on data and patterns. I mean, I think Kartik and I were discussing this. It's like, if, all of these diseases, there's data and patterns that we now have these huge models that can process it all. And, hopefully we'll find, cures for disease, and then I think the thing is to train the clinicians to use AI as insights, but not absolute answers. And that will build trust, I think,
Ah,
with AI moving
wow.
forward.
That like plays right into my next question, really, so well. I want to shift gears and talk a little bit about ethics and trust, because that's a really big component of AI integration and use, right? So in 2022, I know the ANA, the American Nurses Association, released a position statement on ethical use of artificial intelligence. And recently, the National League for Nursing released one too. Of course, with every new wave of innovation comes responsibility, right? And the user of that technology and innovation. But Kartik, how is Skyscape approaching issues like ethics, data privacy, accuracy? I know you said about buzz a little bit. Can you talk a little bit more about ensuring trust in AI as a reliable partner?
Yeah, no, again, great question. I think, especially in healthcare, as I mentioned before, right, it is very important that you ensure the accuracy and trust of the information. And then, as you are communicating with your colleagues or you're communicating with patients, you want to ensure the privacy and the ethics as well. So with Skyscape, we take security very seriously. For example, anywhere where our tools and technology allows, for example, exchange of PHI, like in a bus product, we make sure we are HIPAA compliant. We make sure we have external audits done for our products and to maintain that clinical trust. And this ultimately helps the end user, right? Because you don't want in healthcare, you're going 100 miles an hour, you're caring for patients, and sometimes, in that haste and because you don't have time, you don't want to be fined for the wrong reasons, right? You want to continue to be secure. You want to continue to mention patient privacy. And it's for companies like us that can ensure that by providing the right tools, making sure that the trust is maintained not only amongst your colleague, but also with patients.
Mm-hmm. Thank you for sharing. I think it's so important, especially as we look at health equity too, and thinking about watching for the bias that might be around the data. Now, not necessarily what we're seeing with Skyscape products or Buzz, but leveraging that ethical component is really key. Privacy, confidentiality. So I'm thankful that this is a system that you've really taken that into consideration in the build, and did so in an empathetic manner of the frontline users. as educators and leaders in healthcare, we have a duty, right? We have a responsibility to model, proper use of AI adoption. What advice would you give to those teaching or mentoring the next generation of nurses and healthcare providers about using AI responsibly and confidently?
Yes, because now, I mean, that's in the classroom when we talk to nursing faculty, that's $1 million question. Or should we allow
Yes.
students to write up their notes, or their essays, or using AI, right? How do we detect whether they've used AI? Even though some initially, when AI came in, some schools actually had banned AI. But the
Hmm.
truth is
Yes.
that you cannot keep away from AI, right? You need to embrace it, but you need to embrace it responsibly. You can have
Yes.
some spot checks. There are lots of ways that you can make sure that students are using that responsible AI and not just
Yes.
plagiarizing the answers using chat GPT.
Yes.
And there are tools now to ensure that as well.
Hmm.
Make sure they understand the concept. So along when assignments are handed out, make
Hmm.
sure you're giving spot quizzes. Make sure there are question and answers that chat gpt may not be able to provide, right, along with whatever papers you need to submit. So if you
Yes.
surround your self with the proper processes, then definitely you can ensure
Hmm.
that responsible AI. And then again, only getting answers from trusted content as opposed to chat gpt definitely helps.
Yes, I love that. I've been around healthcare education long enough to have seen that apprehension of use
Yes.
of AI initially, but I'm seeing, thankfully, as I'm more of an innovator, an early adopter, right? Personally. So, but now I'm seeing it's more like shifting to that early majority is starting to come on board. And I believe we're close to a tipping point, but we have to continue to promote it in a responsible manner in education. And even citing the resources where they're pulling that information from is so critical. So thank you for sharing, Kartik. Before we wrap things up, let's just take a minute to look ahead. Kartik, what's next for Skyscape? And are there any upcoming innovations, partnerships, or initiatives that you're especially excited about? I know recently you shared something about a $50 billion CMS initiative. And perhaps there's a way to promote this rural healthcare transformation. What are your thoughts about, how we're going to bridge the gap between workforce development and innovation, and are there any other things that you have on the horizon that you have coming down the pike?
Yeah, it's an exciting time, especially for companies like Skyscape who are at the cutting edge of technology. And we've embraced AI. We've looked in technologies like blockchain. We're looking always ahead as well, right? What is next? Things like quantum computing, for example, is knocking on the door, right? And what does that really mean? uh, for the end users, for the industry in general? It just helps process things much faster. Think about this. In year 2000, right, which
Hmm.
seems 25 years ago, but still,
Yeah.
the cost of sequencing a human genome was $95 million. Fast
Right.
forward now, it's just a mere $200, right? So
Yes.
technology, and the fast processing, like, and now quantum computing will keep cutting this cost down. So what does it really mean, right? It means that it can help the healthcare industry in general. For example, better drugs can be targeted to improve cure, from labs to finish. Things can be
Mhm.
processed a lot faster. The molecules can be permuted, much more faster. Personalized medicine. We all take 50 milligrams of Tylenol, like, or 100, whatever, the same, but personalized medicine in certain cases definitely helps. So all this technology that helps the processing power will
Mhm.
definitely bring a lot of benefit to the healthcare field. And partnering with Power Up Nursing, some of the large visiting nurses associations, for example, we also hope that we can reach out to the rural community. And the bill that you just mentioned is fantastic,
Yes.
kind of thing from the government, because rural health, sometimes it's hard to
Yeah.
reach people in remote towns, and
Yes.
Skyscape has always been focused with mobile devices to be able to reach them pretty effectively.
Oh, Wow, it seems so exciting. I could just listen to you all day or all night and learn. But I think about the way that we're building out programs to reach, nursing students can go out into the community and be part of the communication and care delivery in a meaningful way that we are actually contributing back to, maybe it's mobile food pantries or mobile clinics, even right out into the community, or yeah, just the opportunities are just combining that with technology, how it can improve cost efficiency in healthcare, and also care delivery. Most importantly, the care, right? It comes over the profits because I believe when we take care of the people, the profits will always take care of themselves. But
Absolutely well said.
yeah, Kristen, I just want to say, what excites you most about the potential for AI to transform healthcare and education over the next few years?
I think for me, if you're not using AI, you need to get on the train. um, Basically, anything from meal planning to whatever question, you need, you don't want to hire a lawyer or whatever.
Right.
Or, you have I recently was taking a medication. I was like, oh, well, after this medication, can I take ibuprofen? And it's like, well, no, you have to wait. So, asking those type of questions rather than bothering my physician, I think is good. And I think, for medicine, it's a science, and clinicians because of the way our healthcare system is designed, they don't get a lot of time with their patients. So as a patient, you have to advocate for yourself, right? So you go in there and you can use AI to be like, this is what I'm feeling. Now you have your medical degree here.
Mm,
Let's connect the dots. So my complex case, you're not just going to give me a pill. I really want to know, for me
mm,
specifically, and I think a lot of people feel this way, is like, don't just treat my symptom. Let's dig into the root cause of why am I ill?
mm.
Um,
Oh, yes. I
and,
love.
and help solve that issue, because our population is not healthy, and we need to help figure out why.
Yes, I love it. And getting back to the root cause, asking why 5 times, right? And oftentimes it will take us to, yeah, wow, the answer. So I appreciate you sharing that. Kartik, in closing, what is your greatest hope for how AI will transform healthcare in the next 5 years? Let's say 5 years.
Yeah, so I'll answer it in two parts. One is at a transactional level. I think a big benefit for the healthcare provider is to reduce the documentation burden, right? I see, doctors that I know toiling away at night trying to finish all the documentation that they have to do on a daily basis. The
Yes.
notes, the summaries, the billing, the coding, the CPT codes, and so on. And it's never ending. After a tiring day serving the patients, they have to, do that. So I definitely feel that AI tools like ambient listening and uh, the LLMs that are trained to interpret medical like terminology and codes will definitely help
Mm,
reduce that time and give back time to the busy physicians and nurses, which
mm,
would be a big benefit. At a more transformational level, I think AI can surely help cure diseases like cancer. And you would say, well, how can AI help that? Well, with all the processing speed, as I mentioned, permutation, combination, I think that, it is possible. I mean, if we can send people to the moon, you know,
mm,
I'm pretty sure that, it's not very far away in the future
mm.
for a disease like cancer to be, cured now with help
Yeah.
of technology as well. And then managing chronic health disease like diabetes. Now we have all this technology and AI giving you real-time feedback of what you can do, when you can eat, what you cannot eat, pictures of meals, and AI processing that very fast. So I
Yeah.
think this is
Absolutely.
going to help healthcare and the general population and health population in a big way in the coming years.
Wow. Wow. That is loaded. Kartik, just going back to that time component that you first mentioned, the U.S. Preventative Task Force Surgeon General, to address um, healthcare worker well-being showed that 40% of the time we spend as nurses is documenting. So, when we think about what that can do in allowing nurses to have 40% more time during their shift. But my question to nurses is how are we going to choose to use that time? Like, are we going to use that extra time we get to go back to the heart of where nursing lies, at the patient bedside, in that interaction, creating that beautiful sacred environment that we create as nurses when we care for humanity? I sure hope that that's the case, because that time is a gift, right? And I see that as one of the biggest blessings with AI helping come alongside and support. But like you said, that innovation and coming up with and even preventing disease upstream, right? Altogether, that AI can be a part of helping to create an environment, a community where health can really become a culture, and not sick care, but health care, and what we provide as nurses. So thank you both. Kartik and Kristen, this has been amazing. Thank you for sharing your insights today and your passion for reimagining healthcare while providing resources like what you have through Skyscape and Buzz, with innovation and compassion at the center. I just want to announce or say something to our listeners. Thank you all for joining us today. If you'd like to learn more about Skyscape and their work in AI empowered healthcare tools, Kristen, would you kindly share your email address and where they can learn more?
Sure. You can learn more at skyscape.com, or you can reach out to me, Kristin, Kristin, at skyscape.com.
Fabulous. So until next time, make sure you shoot for the stars and reach out to Skyscape, because that's where it's at. Until next time, again, be well, be bold, and be you. Thank you again, Kristen and Kartik, for your time today.
Thank you,
And
Dr. Elbo.
yeah, my
Thank you
pleasure.
so much. Yep.
Bye-bye.
Bye bye.